Hello guys, welcome back to my YouTube channel Dr.R.K medicos. In this video, we will talk about the axillary artery and its branch. And axillary artery and its branch is very important from point of view of university examination as well as clinically. So continue to watch my video at last and never escape this video. If you are new at my YouTube channel, then please subscribe, like and share my YouTube channel and never forget to press the bell icon so that you will get notification of all video uploaded by me on my YouTube channel. Let's start this video without escaping the time. Firstly, we will see the axillary artery. As you already know that the axillary artery is a continuation of subclavian artery and it extends from the outer border of first rib, as you can see here clearly, to the lower border of teres major muscle. And at the level of the teres major muscle, it continues as brachial artery, as you can see here clearly. And the pectoralis minor muscle divide the axillary artery into three parts. First part lies superior to the pectoralis minor muscle, and the second part lies posterior to the pectoralis minor muscle, and the third part which lies inferior to the pectoralis minor muscle. And now firstly we will see the branch of axillary artery, and that is the anterior circumflex humoral artery. As you can see here clearly that anterior circumflex humoral artery is a small branch arise from the third part of the axillary artery. At the lower border of subscapularis muscle, it passes laterally in front of intertubercular sulcus of humerus and anastomoses with the posterior circumflex humeral artery to form arterial circle around the surgical neck of humerus. Now, we will see about the posterior circumflex humeral artery. As you clearly see here that the posterior circumflex humeral artery is much larger than the anterior circumflex humeral artery. It arises from the third part of the axillary artery at the lower border of subscapularis. It runs backward, accompanied by axillary nerve, and pass through the quadrangular intermuscular space and in by anastomosis with anterior circumflex humeral artery around the surgical neck of humerus. Now we will talk about the third branch of axillary artery, that is the subscapular artery. As you can see here that subscapular artery is the largest branch of axillary artery. It arises from the third part of axillary artery. It runs along the lower border of subscapularis to terminate near the inferior angle of scapula and supply the latissimus dorsi muscle and serratus anterior muscle. Now we will talk about the acromial branch of thyroacromial artery. As you can see here that the acromial branch of thyroacromial artery crosses the cricoid process and in by joining and the anastomosis over the acromion process. Now we will talk about the clavicular branch of thoracoacromial artery. As you can see here that this is the clavicular branch of thyroacromial artery, and it runs superiormedially deep to the pectoralis major muscle and supply the acromioclavicular joint and subclavis muscle. And out of this branch, thyroacromial artery also gives rise the pectoral branch and the clavicular branch. And now we will talk about the lateral thoracic artery. Lateral thoracic artery is a branch of second part of the axillary artery. It emerges at and run along the lower border of pectoralis minor muscle. As you can see here clearly, close relation with the anterior group of axillary lymph node. In female, the artery is larger and give off the lateral mammary branch to the breast.